Welcome back to my channel. This is Dr. Ipshita. Today we will be learning about surgical spaces in orbit. Why this is important? Because most of the tumors that occur in the orbit, they tend to remain within the surgical space in which they are formed. So therefore, knowledge of the main compartments of the orbit and their boundaries, that helps the surgeon to choose the most direct approach to the tumor. So we need to know what are the spaces first. This diagram shows us the different surgical spaces. Let's take them one by one. So first, the subperiosteal space. It is also called the subperiorbital space. As we can see, it is a potential space between the bone. This is the bone and the periorbita. So here is our subperiosteal space. We can see it here. This is the bone and this is the periorbita. So this is our subperiosteal space. This space is limited anteriorly by strong adhesions of periorbita to orbital rim. So what are the lesions we commonly see in this space? We see the dermoid cyst, epidermoid cyst, mucocele, subperiosteal abscess, myeloma, osteomatous tumors, that is the tumors directly arising from the bone, hematoma and fibrous dysplasia. So tumors arising in this space, they usually arising from the bone. They separate the periorbita from the bone, which then becomes thicker and tougher. So it forms an effective barrier against the spread of this tumor towards the eye. We can remember that plain x-rays are mostly useful in diagnosing tumors located in this space. Second, we come to the extraconal surgical space, or it is also called the peripheral surgical space. This is our extraconal surgical space, the blue region. So this lies in between the periorbita and the muscle cone with its fascia. Okay, so here we can see the periorbita and this is the muscle cone. This is the muscle cone with its fascia. So this blue region is our extraconal space. It merges with the central space posteriorly. So what are the normal contents of the space? We have peripheral orbital fat, superior oblique, inferior oblique and the levator palpebrae superioris muscle. Nerves that are present are lacrimal, frontal, trochlear and both anterior and posterior ethmoidal. Veins, superior and inferior ophthalmic veins. The lacrimal gland and half of the lacrimal sac is present in this space. So what are our common lesions in this area? We have malignant lymphoma, capillary hemangioma, intrinsic neoplasm of the lacrimal gland and pseudotumors. So we should remember that the tumors present in this space, they usually produce eccentric proptosis and usually they can be palpated. And most commonly they are approached by anterior orbitotomy and sometimes by lateral orbitotomy. Next we have the intraconal space. Okay, so this is our intraconal space, the green one. It lies within the muscle cone. So the muscle cone and fascia, inside it is the intraconal space within the muscle cone. Okay, what are the contents here? Normally what is present here is the optic nerve and its meninges, the superior and inferior division of the oculomotor nerve, abducen nerve, nasociliary nerve, ciliary ganglion, ophthalmic artery, superior ophthalmic vein and central fat. And the lesions commonly found in the central space are cavernous hemangioma, solitary neurofibroma, neurilemoma, nodular orbital meningioma and optic nerve gliomas. The tumors present in this space, contrary to the peripheral orbital space, they cause axial proptosis and are most oftenly approached by lateral orbitotomy. Then we have the subtenon space, which we can see here. It lies between the tenon's capsule and the globe. If there is any pus collection, it can be drained by incision of the tenon's capsule through the conjunctiva. Then we can mention a subarachnoid surgical space. It lies between the optic nerve and the nerve sheath, the continuation of the subarachnoid space in brain. That's what we need to know about the surgical spaces in the orbit. If you enjoyed this video, please hit the like button, share it with your friends and colleagues. If you find this interesting, subscribe to my channel and hit the bell icon so that you can be notified when there's a new video. If you want me to cover any topic, you can always leave that in the comment section. I hope this was useful. Thank you.